So I'll be focusing on the wrist and hand disclosures. I need to mention for every talk, since this is potentially being videotaped, sorry about that. Consultant for Bioclinica, book royalties from Elsevier, grant from American Institute of Ultrasound Medicine, and research equipment from Harvest Technologies. So we're going to cover these 5 areas in the next 40 to 45 minutes. First, joint effusion and synovitis. So remember that there are 3 joints in the wrist. There's not one, there are 3. And we look at the radiocarpal joint, the midcarpal joint, and the distal radial ulnar joint. So when I'm looking for pathology, I'm looking at each of these spaces because you may only have pathology in one of these spaces. Now the recesses both go volar and dorsal, but the dorsal recess is really where the money's at, meaning that's where they tend to distend more. There are less tissues in the way. That's where I tend to put my needle for aspiration or injection. So remember the distal radial ulnar joint, I tend to look short axis at the radius and ulna. Here's the radius of the ulna. And here we see anechoic fluid coming out around the ulnar head from the distal radial ulnar joint. And as we mentioned in the last lecture, if you have distension of a joint recess and it's not anechoic, there's a differential. Is it complex fluid or synovium? And sometimes you can't tell, and if you're worried about a septic joint, you need to put a needle into that joint. So here's a case of isolated fluid or effusion within the radiocarpal joint. Here's a long axis view. Here's radius, lunate, and capitate. This large joint effusion is only in one joint. Now these 3 joints are separated by each other by ligaments and other structures, so they are indeed separate structures normally. And usually with these joint recesses, if you move the joint, flex and extend, you can see that these will compress and collapse. So we talked about the differentiation between ganglion and a recess or bursa. So when you have an anatomic space, which is a bursa or a joint recess, they tend to collapse with movement and transducer pressure.